Goldstein.
Thank you, Deputy Speaker. Deputy Speaker, I welcome the opportunity to offer a contribution on this legislation because, of course, healthcare and making sure we have access to affordable and viable healthcare for the sustainability of the country is key to get out the maximum benefit and of the human capital of our nation. And, of course, it's also of critical importance to the Goldstein community, Deputy Speaker, because it's always been something I've taken a deep interest in, of course, having a comparatively older population, Deputy Speaker, in the Goldstein community. Access to healthcare services have been of critical importance for people to get the support and services they need at different stages of care. Last week we were in this chamber talking about access to the sorts of essential medicines to manage comorbidities and chronic conditions at latter stages of life, but it's also important to make sure that people have access to the essential medical services they need and the integrity in the health system, which is why it's such a challenge at the moment with the state of health services in the great state of Victoria, where we have a state government that's completely incapable of managing its budget. As a consequence, the decay and decline of health services through tertiary hospitals is a lived reality every single day. We do not want to see this at a national level through primary care services, but we know that because the Albanese government can't contain or manage its budget spending, more and more Australians are looking directly at their credit card or their wallet every time they go to the GP just to be able to get by. They're told by their government that their Medicare card is all they need, but their lived reality is that they need extra co-payments just to be able to get the support they need despite what they voted for at the ballot box. But it's more than that. More and more, Deputy Speaker, we're seeing cons perpetuated on Australians despite the claims of integrity as part of the health system. In 2017, when I was last a member in this chamber, we got an MRI Medicare licence for Cabrini Brighton in the first Medicare-funded licence for an MRI in the Goldstein electorate. I remember when we secured it and many residents asked me the simple question, which is why was it secured for Cabrini Brighton rather than for the local public hospital, Sandy Hospital, as part of the Alfred Health Group? And the answer to that was quite straightforward, Deputy Speaker. It's because Sandy Hospital didn't have an MRI machine. So there's no point getting an MRI licence funded by Medicare if you don't have an MRI machine to use it. Funnily enough, Deputy Speaker, that's where it shocked me slightly at the start of 2025, when it was brought to my attention that Sandringham Hospital had, as part of the Alfred Health Group, been granted an MRI licence. Don't get me wrong, Deputy Speaker, I welcome an MRI licence. I think this is an enormously wonderful thing where there are MRI machines. There's just one problem. Sandringham Hospital still doesn't have an MRI machine. The Albanese government, for some very obscure reason, issued MRI licences to 3 hospitals in Australia. 2 were at hospitals that had MRI machines. 1, which curiously happened to be in one electorate where they desperately wanted to make sure that the incumbent Teal Member of Parliament was returned, didn't have an MRI machine. But it enabled that Member of Parliament to then go around deceiving the community, claiming that they had secured an MRI Medicare-funded licence, even though it didn't have an MRI machine. Have you ever seen Yes Minister, Deputy Speaker, about the idea of a hospital being built without any patients, Deputy Speaker? It's kind of like having a hospital that has an MRI licence but no MRI machine, Deputy Speaker. So I have a pretty simple and baseline expectation, which is, since the Minister for Health has granted Sandy Hospital an MRI licence, perhaps, as part of a system of integrity, the Health Minister could grant us an MRI machine, so we could actually use it. If not, the expression gaslighting, which I seem to be using an awful lot about this government at the moment, justifiably comes to mind. Because what we're seeing now is how our health system in the Goldstein community is being taken for a complete ride. We've not just seen it on this issue. When I was on the board of Alfred Health many a year ago, over a decade ago, we came to an agreement between Alfred Health Group and the Royal Women's Hospital. The Royal Women's Hospital, of course, which is an enormously important hospital and in part fundraised and founded by Vida Goldstein, the woman which the Goldstein electorate is named after. And as part of their maternity services, built out a partnership to make sure that maternity services were available to women in the southeast of Melbourne through the Sandringham Hospital. That partnership ended only a couple of years ago during the period in which I was not a member. Now, of course, I am not going to pass judgment. In the end, it's up to Sandringham Hospital, Alfred Health, the Royal Women's, and of course Monash Health to decide the pathway best to deliver maternity services. But what I see consistently is the talk of integrity and the reality of delivery integrity being completely discordant. MRI licences where there's no MRI machine, a loss of women's health services in the Goldstein community, but not being delivered in the community. And we talk about this legislation. We've just heard from one of the members, the member for Sturt, about what's been happening in the context of vaping. One of the reasons that this country has a big problem with vaping right now is because this government has failed to do any proper regulation around vaping during its tenure and has actively shut down any pathway, including being practical participants in vaping regulation during the time when they weren't in government. Vaping is a known problem for a long time now, but because they have simply wanted to do a close their eyes and ears attitude towards discussing practical regulation, what they have actually let themselves do is let the criminals dictate the terms and the regulation that sits behind vaping. You know, you see this every day at the moment. We've seen this, and this is obviously in the portfolio of small business and has a direct impact on the health and well-being of the community. What's been happening in tobacco legislation and regulation and taxation, where over summer, Deputy Speaker, I read a book about the prohibition movement in the United States back in the early part of the 20th century. And it's extraordinary how many times this government continues to repeat the errors of that period when it takes its approach to tobacco regulation, where it actively fuels criminal gangs through its policies and criminal behaviour. Of course, we're seeing that in the terms of the impact it's now having on small businesses, where you might as well be having government ministers handing the criminal gangs and organised crime firebombs to destroy people's lives and livelihoods. That's how much they're stoking the behaviour through different forms of taxation, which is actively increasing the premiums that organised gangs are then having incentive to go and engage in criminal activity, and is having a direct impact on small businesses across this nation. This is the problem, Deputy Speaker. We have a government that talks integrity but is not practising it in terms of their operations, and the people who are paying it are people on the ground in the Goldstein community, small businesses, and they do it under the veneer of their boastfulness in talking about their government programs, but not in terms of what they're building to improve the future of Australia, and Australians are suffering for it. Speaking of integrity, Deputy Speaker, the other place we're seeing this, of course, is not just in areas around health, but also in other areas like the National Disability Insurance Scheme. And to give you a parallel of just how much there's a problem now around integrity and this government and how much they're struggling, we had a roundtable bringing together service providers in the healthcare and NDIS space who raised concerns specifically around NDIS pricing arrangements, and particularly the 3-week notice they were given for pricing adjustments in the lead-up to the financial year, for the 25-26 financial year. The attendees, Fiona White, Dr Shona Biscoff, Stephanie Williams, Simone Emery, Lauren Gingold and Taryn Dee. And we spoke about the adjustment of the measures that the government introduced as part of their pricing review and the consequences and the human consequences of what happened when it went down the pathway of so-called integrity measures. And what was the impact? Well, they were reducing the volume of sessions that they were having with clients. It was reducing the travel times they were prepared to directly engage and support people who were in need. The decrease in the personalisation of the service, particularly for people who had acute conditions or needed additional support. Of course, in addition to that, it had a direct impact on those who are most marginalised, because this is one of the biggest problems, Deputy Speaker, when you have people outside of urban communities or affluent communities. The further you get away, the more you cut travel times or reduce access to service providers, the more it's people in lower socioeconomic communities or further distances or rural and regional areas that suffer. And I think you would understand a bit of that, Deputy Speaker, considering the nature of your electorate. And in the end, the impact is downstream and has a bigger impact because you have a failure of earlier intervention, which pushes up costs in the long term, which then drives up the cost of tertiary hospitals. And you know the most devastating thing is the more you spoke to NDIS providers, and you're seeing this in other areas of healthcare services and social services, is at no point has there been a focus by the government on a really critical part of service delivery, which is actually on reducing red tape. And we're not saying red tape because we want to get rid of regulation for no purpose, but the needless burden that which actually takes practitioners out of their core focus and effort of caring and supporting things like children and putting that energy into filling out paperwork. Now, I don't know about you, Deputy Speaker, but of course there's a role for filling out certain components of forms for compliance. I'm not arguing against that. And of course we need to make sure that people are doing the right thing. But when a practitioner is telling us stories about how they spend more time filling out paperwork than they do care, when they're spending more time complying with the NDIA's regulation than they are in working with paediatric support for people with a disability, when they're spending more time finding out how it is they're going to make sure they can keep their practice open than they are making sure they get to people of disadvantage, you start to think that maybe this government's priorities is more focused on how they can build the bureaucracy than they're focused on how they can build the benefit to Australians. I mean, it shouldn't surprise. You read the Daily Telegraph today and you see union bosses' wages increased by 25% while construction workers' pay going down 5%, and you start to realise that this is just one giant cartel where it's trickle-up economics that feeds the few at the expense of the many. Now, whether that's in construction, whether that's in the NDIA, whether that's in making sure there's service provision in the healthcare sector, it doesn't seem to matter where their priorities or their focus is. Australians are at the bottom of the pile. It's our job to make sure that we hold this government to account, Deputy Speaker, and make sure that Australians have a voice and are stood up for. What's dispiriting is that there's such a dismissal and disinterest from this government when the consequences are so human. And when we have a situation where we have a minister gaslighting the Goldstein community and issuing Medicare licences for MRIs, but then won't even provide an MRI machine, when they actively fuel organised crime, when they actively engage in interfering and undermining the provision of healthcare services that desperately need integrity, you do have to start to question what this government's priorities are, and you realise it's itself, not the Australian people.